Nosebleeds can strike any time, particularly during the cold, dry months of winter. While they can be a messy nuisance, they are rarely an emergency. When a nosebleed strikes, remain calm. Lean forward. If there is blood in your mouth, spit it out. Do not swallow it. Apply 3 sprays of decongestant spray, such as Afrin, into the side that is bleeding. Pinch the soft part of your nose shut. Pinch the nose for 10 minutes. Use a clock to keep track of time. Resist the urge to release the pressure on the nostrils after a few minutes. After 10 minutes, let go of your nose. If it is still bleeding, soak a cotton ball with nose spray and place it into the bleeding nostril and pinch for another 10 minutes. Again, use a clock to time it. Once bleeding has stopped, do not blow your nose for at least 2 days. Check your blood pressure if possible. High blood pressure can cause nosebleeds. Do not pinch the bony bridge of your nose. Remember, pinch the soft part of your nose closed. Do not pack the nose with tissues or other household items, like gauze, tissues, or tampons. This can make the bleeding worse. Do not tilt your head back or lie flat. This may cause you to choke on blood. In addition, blood in the stomach can make you nauseous and cause vomiting. Do not lift anything heavy, like groceries, or perform physical activities or household chores such as vacuuming. Do not pick up young children and babies. Avoid activities that involve bending over and causing the pressure in your sinuses to increase. Remember, it can take up to 2 full weeks to heal after a nosebleed. Preventative care is essential when managing nosebleeds. Most of the products used to treat and prevent nosebleeds can be purchased at your local pharmacy. It is also important to keep your nose and nostrils moist during the dry months of winter. Some ways to keep your nose moist include: use an over-the-counter nasal spray every 2 to 3 hours while you are awake. Use a cool mist humidifier to moisten the air in your room while you sleep. Coat the inside of your nostrils with Vaseline or air saline nasal gel twice daily, especially at night. Some patients prefer to place a cotton ball coated in Vaseline in the affected nostril overnight. If you use steroid nasal sprays, such as Flonase or Nasocort, call your doctor and ask if you need to continue their use. Steroid sprays can dry out your sinuses and increase the risk of nosebleeds. Remember, using nasal saline spray and Vaseline are the best methods for preventing nosebleeds. It is important to contact your anticoagulation provider about your nosebleeds. They may want to perform a blood test or determine if there have been any other changes in your health. If you continue to experience frequent nosebleeds, you may benefit from an evaluation by an ear, nose, throat physician. Keep in mind that the anticoagulation clinic can help arrange that appointment if one becomes necessary. It is important that you contact your anticoagulation provider if you have more than 3 to 4 nosebleeds per week or more than 6 per month when following the tips provided in this video. Nosebleeds are a nuisance, but rarely an emergency. However, there are some situations when nosebleeds require immediate medical attention. Bleeding that does not stop in 30 minutes, bleeding that is very heavy and that includes blood running down your throat and out of your nostrils, bleeding with other symptoms, including, but not limited to, high blood pressure, dizziness, chest pain, or rapid heart rate. These symptoms may require special treatment. Remember, nosebleeds are common in patients who take blood thinners. They can be frightening at first, but are rarely dangerous and can be easily managed at home if you know what steps to take to prevent them and what to do when they occur.